Chapter 4, Pharmacology. This is the full video of my lecture for the substance use disorder, counseling, and chemical dependency classes. In this chapter, we examine the ways drugs get into the body, called routes of administration, how drugs move around, and how they are eliminated. We also cover some basic information about drugs and their characteristics. This video, Pharmacology, by David Joel Miller. Some of the material originally was on counselorsoapbox.com, my blog. The photos are from Pixabay and Wikimedia Commons. One division of pharmacology is pharmacokinetics, how drugs move around. Factors that affect this are the drug dose, the routes of administration, drug absorption, biotransformability or bioavailability, drug distribution, and drug elimination. Some of the things that are involved in pharmacodynamics, how the drug does what it does, are the dose-effect curve. A certain minimum amount of drug has to go into the body before it has any effect. As the amount in the body and the bloodstream rises, the effect gets larger and larger until for most drugs, at some point, it reaches a maximum amount, and beyond that, either it's fatal and kills the person, or it no longer does any more to have more in the bloodstream. For every drug, there is a minimum effective dose, and there is a lethal dose for many, many drugs, almost all of them. What we need to know is the distance between the effective dose and the lethal dose. That tells us the safety margin. Some drugs are very, very safe, and the dosage doesn't really matter that much above an effective dose. Other drugs, the lethal dose is fairly low and the safety margin very narrow. We'll also have to talk a little bit about drug interactions, because multiple drugs taken together don't always work the way people expect them to. Pharmacokinetics is the branch of pharmacology that concerns absorption, distribution, biotransformation, and excretion of drugs. How drugs are absorbed, how they get into the bloodstream, distribution, how they get to the site of action, metabolism, the process by which a drug is broken down, and this is all affected by the way the drug enters the body. How does this drug dissolve? Some drugs are largely water-soluble, some are fat-soluble. A few, in medical settings, don't dissolve at all and are simply suspended in the liquid. Some other factors that are important if you're studying pharmacokinetics is bioavailability, what part of the drug is effective. An example of this might be many women, when they are pregnant, are told to take calcium. Well, it's true we could take limestone and grind it up. It's very high in calcium, but it's not very bioavailable. Most of that would simply go through the body undigested and come out the other end. We also need to know diffusion rates. How rapidly does the drug go from a pill in your stomach to spreading out into the intestine and into the blood, and how rapidly does it spread throughout the body? And how is it excreted or eliminated? Characteristics of the drug affect the experience, particularly the dosage, how much you take. For medical purposes, the dosage is determined by body weight, which is typically calculated in milligrams per kilogram of body weight. More body fluid, more blood, more water in the blood, dilutes the drug more and may require an adjustment of dosage. Somebody who's very small, a child, has very little blood, and a small dosage would be plenty. A very large person might require a higher dosage. Among the characteristics of the drug that affect the user's experience, a large one is the route of administration, how drugs are put into the body, and it is incredible how many different ways people seem to be able to find to get the drugs into their body. The oldest method probably first invented was oral, which is eating it. Sometimes in the older literature, they refer to drug eaters, even though they're talking about dissolving the drug in a liquid and then swallowing it, something we would call drinking. Oral use is probably the safest because part of the drug is broken down and digested in the stomach, and then it is absorbed in the small intestine. So it's a fair amount of the drug has already been metabolized even before it gets into the bloodstream. Also, oral doses will go through the bloodstream and may pass through the liver and kidney, and more of it may be metabolized and reduced before it reaches the brain or other site of action. Injection is another method many people are familiar with. Actually, injection can be done in 3 separate ways, and there are reasons why it's done these different ways. One is subcutaneous, sometimes called skin popping. In this method, the skin is pulled out and the needle put directly under the skin. Substances that are dissolved in a liquid and injected subcutaneously gradually are absorbed. Intermuscular is one many people are familiar with, either a flu shot in the arm going into the muscle, or if you were younger, they might have given you a shot in the rear end of something that would slowly dissolve from the muscle. The fastest one is intravenous. In the hospital, if you go into emergency, the first thing they'll do is put an IV into your hand, probably, in order to be able to get drugs into your system and into your bloodstream immediately without going through the liver and the kidney to be metabolized. IV drug users find this is very quick acting and puts the drug directly to the brain. Some other routes of administration are inhalation, which the common name is smoking. In this method, small amounts of the drug enter the lungs. There are lots of little capillaries there which absorb the drug, and it can go from there directly to the brain. This is a very fast route of administration, although it provides a very small dose into the brain. Another similar inhalation method is nebulizing, in which rather than burning the substance and having a hot smoke, a very fine, cold or room temperature vapor can be breathed in. There are also inhalants, and we'll talk about that in a later chapter, that come out of spray cans and various other ways of getting them into an aerosol to be breathed in. Intranasal is the scientific or complicated name for snorting of drugs. Sublingual is to place the drug under the tongue and have it absorbed through the mucous membrane there. There's some drugs that are available as thin films that can be placed under the tongue and absorbed very rapidly. This is particularly useful for the elderly or people who are severely debilitated and can't swallow. Transdermal is a way of applying a substance to the skin. Some drugs can be absorbed directly through the skin, and some can be mixed with a solvent, and that makes them more readily absorbed through the skin. On drug evaluation forms, there's often a place for marking other. Principally, this is meant for suppositories. For example, in people who are severely ill and constipated, it may be necessary to insert the drug, the suppository, into the rectum. However, drug abusers sometimes attempt to insert drugs of abuse in that manner also. Let's take a look at some of these routes of administration in a little more detail. First, oral drug use, sometimes called eating. Oral is the safest. It's very convenient and it's economical. The drug passes through the stomach, mostly absorbed in the small intestine. Food in the stomach affects absorption. Some drugs, you'll notice the label says, prescribed medications, to take on a full stomach. Others, it may say to take on an empty stomach, so it will pass through and be absorbed more readily. Some issues with oral drug use. The drug is absorbed in the bloodstream slowly, may break down in the stomach acids. Some drugs are almost completely broken down in the stomach. Since it passes through the liver and is partially removed before it reaches the brain receives a much lower dose. For example, marijuana may require 3 times as much taken orally as it does when smoked in order to have the same effect on the brain. This partial movement through the liver partially removes it. Only a fraction of the drug that is swallowed ever actually reaches the brain. Some additional information on the 3 ways of injection. Injection, the drugs have to be either dissolved or suspended. Sometimes this involves heating the liquid, called cooking. Subcutaneous or skin popping, the drugs are injected under layers of the skin. Some drugs can really irritate the tissue and may cause blistering and swelling. And subcutaneous route cannot be used if large volumes are needed. Intramuscular has faster absorption, but the absorption depends on the blood flow to a particular muscle group. There may be localized pain in the muscle. There's a risk of infection anytime you use a needle and break the skin, but particularly with IV and intramuscular because the needle goes so deep. It can cause tissue damage, and some drugs can irritate or damage the muscle. Intravenous drug use, IV drug use, is the primary way in which drugs of abuse are inserted by needle into the body. This is often called mainlining or more recently slamming. In this route, the drug goes directly into the bloodstream. Absorption problems are avoided. The effects are almost immediate. Irritating drugs can be taken intravenously. In the hospital, they'll put up and a line in a large volume of liquids can be quickly inserted and reach the site of action. However, there are far more complications. Infections can happen whenever something breaks the skin, but in street drugs that are used IV, there are cutters, things that are used to mix with the substance, the drug of choice. And often those cutters are things never intended to be inserted into the vein. Very insoluble things such as baby powder, talcum powder may be mixed in with IV drugs. There's also the problem of shared needles. Part of sharing is the lack of clean needles, but part of it among communities of drug users is also a social thing. People who use heroin may get together in small groups. They'll cook and they'll each take a turn using the same needle. There's a huge risk there of infection from HIV or Hep C. In my area, more people die every year from hepatitis C than from HIV. But those and other bacterial infections are common. Veins get hard and it becomes, because of scarring of the vein, it becomes more and more difficult to find a place where the user can insert it. They may go from no longer using the arm to putting it into the neck or other places. Often in IV drug use is used for drug combinations. Heroin and cocaine originally was called speedballs. And then people began to mix heroin with methamphetamine because meth is longer acting and cheaper. For a while I was hearing people call that train wreck. Now I think many users simply use the term speedball as a generic for heroin and any stimulant mixed together. Inhalation, taking it in by the lungs. The primary method would be smoking, although there are newer and newer ways of doing this. In addition to smoking, we also have vaping, in which the vapor is taken into the lungs. In the chapter on nicotine, we're going to talk more about vaping. However, it's important to note that it's not just nicotine or tobacco that is used in vaporizers. We've seen some people in my area using methamphetamine or other hard drugs in the vaping pens. Nebulizers are used in the hospitals, often with infants, but it puts the liquid into fine aerosol droplets and allows for inhalation. In fact, in some places they've tried nebulizing alcoholic beverages. You can put on the mask and take in a few breaths of the alcohol vapor and you are almost instantly intoxicated. Inhalation gets the drug to the brain without it traveling through the body. The blood level goes up very quickly, but it comes down very fast. The result, any drug taken via smoking or inhalation is going to be more addicting than the same drug taken via a different route of administration. You get a small dose with each puff. Think about the thousands of doses per day that a pack-a-day smoker is getting. This explains some of the reason that tobacco is so addicting. The primary drugs that are smoked or inhaled are tobacco, crack cocaine, which is a smokable form of cocaine, crystal, methamphetamine, and inhalants, which are not heated but are put into an aerosol and breathed in various ways. Some of the other routes of administration, intranasal or snorting, mainly this is powder, which is cocaine. Heroin can be snorted, or tobacco snuff is snorted in some places. Sublingual, under the tongue, is preferred to oral for drugs that irritate the stomach and could cause vomiting. It's mainly for very sick people, but some of the very potent opiates are available in these sublingual films and are diverted for street use. Transdermal works through the skin, and this works for drugs that upset the gastrointestinal tract. One common use for transdermal are patches for pain or for nicotine. And of course, other drugs can be available in suppository for people who are too weak to take them, or for people who are into the drug use and want to experiment with inserting the drugs there and having them rapidly spread through the body. Drug absorption and bioavailability. Absorption is how fast it leaves the site of action. Bioavailability, the portion of the original drug dose that reaches the site of action or dissolves in fluids to get there. Some compounds dissolve easily, others go through the body largely undigested or unmetabolized. Some simple information about drug distribution. The regions of the body that get the most blood get the most drug for any drug that's dissolved in a liquid. The heart, the brain, the kidney, and the liver get much larger doses. Fat-soluble drugs penetrate membranes. Some drugs bind well to proteins in the blood. Marijuana, for example, is very fat or lipid soluble. PCP is partially soluble in fat. This explains why these two drugs, being more fat-soluble than water-soluble, are present in the body longer and show up on drug tests far longer than water-soluble drugs. Drug elimination. Most drugs are metabolized in the liver. The liver has many enzymes to break things down and produces more of these enzymes. They can also be metabolized in the kidney. A small amount can be metabolized in the stomach or eliminated via the breath. Many things happen to a drug in the body. The first pass effect is important. This tells us how much of the drug is broken down during digestion in the stomach and the gastrointestinal tract. Some of the metabolites, the breakdown products, are also psychoactive. Cocaine is a good example of this. The kidney excretes the majority of drugs and metabolites which leave the body in the form of urine. And those drugs, or their metabolites from breakdown, will show up mostly in the urine. Some drugs may also leave the body in the breath and in sweat. The kinetics twins, or ways in which drugs move around and are metabolized, are important with one drug in particular. Zero order kinetics are the body metabolizes at only one speed. Alcohol, most people with a healthy liver metabolize about 0.02 blood alcohol content per hour, no matter how much is in this bloodstream. Drink one drink an hour, and presumably after it's been in your system for an hour, so 2 hours after drinking, your body will have metabolized pretty well that whole drink. If you continue to drink one drink an hour, then it should be metabolizing that right on time. However, if you drink 2 an hour, your liver will not metabolize it any faster. Therefore, there is no half-life. If your blood alcohol content reaches 0.30, it's going to be at least 15 hours before your liver can deal with all of that. First order kinetics, the speed of metabolism depends on the amount in the bloodstream. Double the drug and the body works twice as fast. The half-life for the first order drug is constant. For example, cocaine. Every so many hours the body removes half of all the cocaine in the system. One problem with calculating these kinetics, zero and first order, is that if both alcohol and cocaine are present, the liver will concentrate on getting rid of the alcohol first, and so the metabolism for other drugs, such as cocaine, are much slower, and that results in a longer half-life and higher blood alcohol and blood cocaine concentrations. Half-life is another factor. Some textbooks and classes make a big deal out of it, and some say it doesn't matter. The half-life is how long does it take for half of the drug to be gone. Except for alcohol, with its zero-order kinetics, most drugs we can calculate this. And as the drug is broken down, we want to know how long are the metabolites in the bloodstream, because many of those metabolites are psychoactive. From this and the percentages of various metabolites, it's possible that they can calculate how much was taken of a particular drug and how long ago that drug was taken. Anytime we talk about drug use and abuse, one of the topics we need to consider is testing. It turns out that there are many ways to test. Some are more reliable, and some are more reliable for certain drugs than others. Breath tests are possible. They're commonly used breathalyzer for alcohol. Several companies are currently working on breathalyzers for marijuana, and I think they're likely to be available soon. Certain drugs leave the body through the lungs at a fairly constant rate, so whatever amount is in the breath tells us what's in the body. A very accurate way of testing is taking a blood sample. However, to run that test, or run any test really, we need to know what drug we're testing for. So most blood tests will, in the hospital, will test for 10 or 11 common drugs, or maybe only 7 common drugs. Often they don't know what they're looking for, and that makes it very hard to know what to test for. Drugs can commonly be detected in urine. Again, the top 7 or 11 drugs are normally what are tested for in urine. Hair provides a record of whatever drugs were taken from the time the hair left the body. I've had clients say they can only go back 30 days or 90 days, and I think the truth is that depending on the length of your hair, yet that hair is a record of every drug you've taken for the whole time. Because of the cost, most hair follicle tests only test a small sample. They remove the hair, cut the root off, and take about 1.5 inch sample and test that. But in theory, it would be possible to continue to test samples of another section of the hair and go back farther and farther, simply that the cost of doing that is prohibitive. Sweat could be used, although it rarely is, as a way to test, but saliva tests are becoming increasingly common, especially in the area of chronic pain doctors. Some people simply can't give a urine sample with the time that they go. Well, if you're working in substance abuse, failure to give a urine sample would just be considered a dirty test. But for people who are very sick and taking pain medication, they may not be able to urinate on demand, and you can't simply cut them off from their medication and throw them into withdrawal. So increasingly, medical settings, chronic pain doctors are using swabs and saliva tests for that. Testing is affected by the rate of metabolism, the half-life, for certain drugs. There's always the question of the accuracy. Some of the instant tests will give you a quick reading, but they have a wide range of accuracy. In drug treatment, if you get a positive on an instant test, the common practice is to then send a sample out to a lab for a full confirmatory analysis. Every group of addicts using a particular drug have their way, and they tell each other how to beat drug tests. The truth is there are some ways to beat drug tests, but the drug test manufacturers keep looking for ways to detect people who are cheating. So it's a constant battle going back and forth with, oh, do this, and then guess what? The test manufacturers detect that, and now they can give an accurate answer again. One way many people try to beat drug tests is called flushing. They drink large volumes of water and dilute their urine, hoping to get the drug that's coming out of their body to such a low concentration it won't be detected. However, the drug labs that do drug testing can readily detect this. The amount of solid material in the urine is too low, and therefore, if it has half as much solids as it's supposed to be, they can double all the values, called normalizing, and suddenly the small amounts that weren't detectable become detectable, and now you have the user has a positive drug test. So flushing has turned out not to be very effective. The bottom line is the only effective way to get a clean drug test is simply don't do drugs. Some other testing issues. Clients will try to beat the test by substituting. They may grab a container when you're not looking, take it home and have some family member fill it for them, warm it in the microwave and bring it in and try to switch it for another clean container. Another way they try to beat a test is by adulterating tests, adding some substance to the container that will alter the test results. Diluting. Many testing sites do not allow the person to have sink or access to water or have water in the toilet when they go in to use it. And also people try to flush by consuming large quantities of liquids. All of these can be detected if the person doing the testing keeps a very close eye on the urine leaving the body, entering the container, and then the container up until it's turned over to them. Also, we need to talk about the subject of false positives. One of those can happen when they have a prescription for medication. Anytime a client is taking prescribed medication, the counselor should see the prescriptions, have copies of the labels, or record what exactly the client has prescriptions for. And that will allow you to tell whether the positive is the result of a prescribed med. There are some over-the-counter meds that can give some positive results that look like a drug of abuse, and it's important to be aware of that. If the client is taking those over-the-counter meds, you need to know that, and further, you may have to prohibit them from taking those over-the-counter meds while they are in drug treatment to get accurate drug test results. Pharmacodynamics is how does the drug do what it does when it gets to the place it's going. We've talked about the dose effect curve, that small amounts of drugs don't do much. Through the relevant range, more drug does more. And at high levels, pouring in more drugs into the system probably doesn't produce much result. twice as much drug does not always do twice as much. Most of this is not important for drug counselors, as most drug counselors or even mental health counselors in most jurisdictions do not write prescriptions. But these are things we need to be aware of and sometimes consult with the prescribing doctor. It's important to understand the difference between side effects and allergies. Many people will take a medication and have a reaction and think they're allergic to it. But in fact, side effects are expected some of the time for some people. Allergies are an excessive or unexpected reaction. So whenever taking a new medication, if you have a symptom occur, you may want to consult with your physician if this is an expected side effect or if you are in fact allergic to the medication. Effective dose versus lethal dose. How do we measure ED and LD? Remember, in drug counseling, ED stands for effective dose. The effective dose is how much does it take before the user feels it, if it's a psychoactive drug, it changes the mood, or before it does what it's supposed to do. The LD is how much does it take to kill you. Now, originally lethal doses were calculated by feeding a certain amount of drugs to a large group of rats and waiting, increasing the dose until half of the rats were dead. By calculating based on body weight, we could easily tell how much it would take then to kill half of the humans. LD is normally LD 50, how much will kill half the people who take it. So by knowing the distance between the effective dose and the lethal dose, we want to know how much that is, and that is often called the therapeutic index. The lethal dose divided by the effective dose, the higher that number is, the more safety. The closer together those two are, the smaller that number is, the more dangerous and the more carefully that drug needs to be monitored. Some psychotherapeutic medications prescribed, the client needs to have regular blood tests because if they have too little in their bloodstream, it doesn't work. Too much in their bloodstream may begin to damage organs and impair their health. Another psychopharmacological principle drug counselors need to be aware of are drug interactions. An interaction is when one drug alters the effects of another. In synergism, 2 plus 2 equals 6. A great example of this is drinking alcohol while taking tranquilizers or sleeping pills. Two together depress the nervous system much more than either one separately and have a high risk of death. Antagonism is where 2 plus 2 only equals 1. For example, taking iron pills and thyroid medications, some of them together, may render the thyroid medication ineffective. So by mixing two drugs together, taking them at the same time, you get less result. It's common, especially in seniors, where they're taking multiple meds, to find that two of the drugs that someone is taking are interacting and causing a problem that was unexpected. It's important to think about drug names. Sometimes they can be confusing. But let's use a simple example of how one drug can have many names, and we'll use salt. And by this, we're talking about table salt. Realize there are other kinds of salt, Epsom salts and so on. But it might have a street name. If you go into the store and pick up a container of seasoning for barbecue, it probably will contain salt, maybe some pepper, and a few other ingredients. You might have a drug name, salt. You might have a chemical name, sodium chloride. You could have the formula, NaCl. You could have a brand name, Leslie or Morton, or you could have a generic label, which you see on many lower price table salts. Table salt, that's a good generic name. The same thing happens with many drugs, both psychotherapeutic, and drugs of abuse. You will have a common name people call it, you may have a brand name, and you may have the actual chemical name or chemical formula. Here are some of the terminology that was used in this video and in the chapter that we're studying in class. It's important that you know the meanings of these words. Pharmacokinetics, pharmacodynamics, over-the-counter drugs, OTC, bath salts. We'll talk more about that in the chapter in the video on stimulants. Talked earlier in the one on neurotransmitters about agonists and antagonists. Mentioned the blood-brain barrier, side effects, half-life, LD, lethal dose, ED, effective dose. We've also talked previously about cross-tolerance. Here we talked about drug names, chemical names, generic names, formula. We've also mentioned, or I do in class, formication. We'll see that again in the chapter on stimulants. Formication is when taking a drug and it causes the sensation that some kind of insect is crawling on your skin. We also will talk coming up shortly about state-dependent learning, how having drugs in your bloodstream may affect what you learn. Among drug counselors, it's common to talk about relapse. That is how people use drugs for a while, or without them for a while, and then begin to use them again and get different results. And we talked about absorption and bioavailability. Here are some of the things that a student in my class would have learned from this chapter and from the lectures. Route of administration. Oral, called eating, is the safest because the drug is digested in the stomach, absorbed in the small intestine. Injection comes in 3 types: subcutaneous, called among addicts skin popping, intramuscular, and intravenous or IV drug use. We talked about inhalation, which is commonly smoking very fast, but which could also be vaping or nebulizing. We'll talk more about inhalants later in video number 14. Another route of administration is inhalation, commonly called snorting. Sublingual use is a particular formulation for drugs, and it's placed under the tongue and absorbs. Transdermal are things that can be applied on the skin, such as a nicotine patch. And if you see the indication for other, it's probably a suppository inserted into one of those openings lower in the body that has mucous membranes. Some additional things I hope you have learned from this video. Most drugs are metabolized in the liver. The liver has many enzymes to break things down. Some are metabolized in the kidney, and many drugs are excreted by the kidney in the urine. A small amount could have been broken down, metabolized in either the stomach, or could leave the body via the breath. You should know the difference between LD and ED as it relates to drug counseling, and the many ways in which we might test for the presence of drugs in the body. That could be in the breath, in the blood, the urine, the hair, the sweat, or saliva. Drug counselors need to understand these different ways of testing, which are more convenient, cheaper, and more reliable.